Horowitz is Vice President for Education at Planned Parenthood of Western Pennsylvania, and she earned her master's in public health from BCHS in 2012. She did her practicum work in Mexico, and she is pleased to serve as a member of the U.S. Board of Directors for the health organization. I assume she's going to tell you a little bit more, Perry Hilltop Citizens Group. She's also a board member. She has worked in youth development for 8 years, having started her career working here in Pittsburgh. In the summer, she leads trail crews, and she is a Pittsburgher, born and bred, and she is driven to help improve sexual and reproductive health outcomes and disparities for everyone. And we are so excited that she's here. So come on up.
Thanks, Mara. Hi, everybody. I'm so thrilled to be here today. It's really, really nice to be back. And I'm going to tell you a little bit about my story, same as everybody, and about what I'm working on right now. To be honest with you, I really sort of fell into public health. I had my first real job here at Pitt about a year after undergrad. And I used to come up to the Commons to eat my lunch. It was not nearly as fancy as it is now, but it was a nice place with natural light, and I used to eat there. But I had no idea what public health was. I knew I was in the public health building. So being a good student, I marched myself down to the library, and I probably literally searched public health in the catalog. And I turned up Pathologies of Power by Paul Farmer. I'm imagining that like 75% of us reference this man in our personal statements. Sorry, admissions committee. But the philosophy that he laid out in that book was honestly like a bolt of lightning for me. I was raised with the understanding that A, I was extremely lucky, B, I should be extremely grateful to be so lucky, and C, that it was my responsibility to share my luckiness with people who had less luck. My mom was really the main messenger of this, but I got it from my Unitarian church, which, by the way, is where I first got sex ed, and you should look into that. It's really amazing. From the books that we read, probably from my dad a little bit, too. In this picture, I am smiling. I'm on the one on the right over there. But I was honestly probably feeling very ungrateful because I totally hated fancy dresses, and Easter was the worst for that. Now I call that luck privilege, and now I have a worldview that thinks about capitalism and structural racism and a school-to-prison pipeline and all of the awful ways that inequity plagues, and I use that term very intentionally, our world. But since I was little, I knew that if you have privilege, you also have responsibility. In college and a little bit after, I did a lot of anti-globalization and anti-war organizing. I organized protests and rallies and teach-ins. But to be honest, I've always been a really concrete person. And so when after all of that work, a war started anyhow, I got really sad and disillusioned. And it felt really hard to see that way of spending my energy as the best use of time. We definitely need people organizing like that. I want to make sure to say that, but I just needed to do something different. So I retreated from that kind of social justice. I spent a couple years pretty unsure what to do with that energy. And when Paul Farmer, in his book, told me, and I'm paraphrasing here, that disparity is not inevitable, that we can track down the social causes of suffering, that much of people's suffering connects directly to bodily and mental health, and that those of us who bear witness should act against injustices and disparity however we can, with public health being a really excellent entry point. That was just exactly what I needed to hear, and I think I probably closed the book and went and enrolled in Dr. Document's research methods class. My good luck really continued in that I started working at Planned Parenthood literally the day after I walked across the aisle in my cap and gown. So no rest for the wicked. My job is vice president for education, so I run the education department, but I started there in a different role as the peer education coordinator, running a program called Peer Helpers. This is a program that we are super proud of. It works directly with middle and high school youth in Allegheny County in their schools, where for one period a week on the same day each week, the kids come out of class to come to our class. We teach comprehensive sexuality education with two goals. One, that our students graduate high school, and two, that they do so without being involved in a pregnancy. And over 26 years of this program, we've met those goals very consistently. These are some youth from Wilkinsburg High School. This is from my first year working the job, and that is a dragon boat in the Allegheny River that we ferried down the river. It was really fun. This program to me still represents the beating heart of what we do in our education department. In all of our work, we try to be allies to youth, and we try to provide them with the information, skills, and access that they need to take care of their reproductive and sexual health, whatever that means for them now, soon, and into the future. For this reason, we talk to them about condoms, we talk to them about birth control, we talk about consent and healthy relationships and breakups and STDs and gender and personal values and about a million other things. Sexuality, as you're all aware, is complicated, and it touches so many parts of our lives and our identities. There's a major gap in required school curricula around this topic, especially given that over a decade of research has identified health education interventions that are shown to be effective through rigorous evaluation. If there was a math curriculum with this much evidence, we would require it everywhere. At least I hope we would. I guess evidence and facts have sort of a complicated role in our discourse right now. Teaching sex ed to youth is definitely our bread and butter, but it isn't the only thing our department does. We also work with adults, mostly youth-serving professionals and parents, on how to talk to youth about sex and sexuality. We also get involved with collaboratives and coalition efforts around the city, and just this past year, we were extremely proud that we applied for and received a grant from the FISA Foundation to hire an educator who's solely dedicated to doing sexual and relationship violence prevention education. We also run a sexual health text line. This is a number that anyone, anywhere can simply text with their sexual health question, and they receive a personalized answer in 24 hours. In addition to increasing access for people out there in the world with questions, we also had a mobile app developed that allows our peer helpers to actually staff the line and answer their peers' questions with adult oversight, turning the whole service into an educational intervention. This is a group of our Stowe Rocks peer helpers. At the very beginning of this project, we had just gotten a grant to get a classroom set of tablets, so they're showing them off. IOTAS is a really exciting project. It's okay to ask someone IOTAS. And I've been able to work on it in both positions from start to finish. We've been really lucky to apply for and receive several grants for this project, and we couldn't have done it without our BCHS co-conspirators, Tegan O'Malley, Dr. Jesse Burke, and Dr. Stina Mayer, who we're super appreciative for. Working with people, trying to find solutions to old problems, planning programs, applying for grants, it's all public health. My personal day-to-day varies a lot. Here are some things that were part of last week and this week. I had a management meeting. I have lots of meetings all the time. These are conversations among senior level managers where we discuss staffing, policies, finances, which is a big topic for us at Planned Parenthood right now, as you can imagine. I worked on a report for a foundation, gathering numbers of participants and classroom anecdotes and trying to make sure our story gets told well to people who are very supportive but want to hear that we're doing good work with the money they've given us. I met with our External Affairs Committee where we talked about and planned for all of the upcoming events to engage the literally hundreds of volunteers that have signed up since the election, which is very exciting, and to raise our visibility and bring a message that speaks up to those who oppose us. That's a very real aspect of my life, dealing with opposition to Planned Parenthood and everything that comes with that. I met with staff of AIDS Free Pittsburgh, and we reviewed and approved ads promoting PrEP for HIV prevention that will go up on city buses in February. Please look for them. They're really awesome. This is the advisory board for that group. We're trying to make A's, F's, and P's in that picture. It's not working that well. They're doctors, they're people from the Jewish Healthcare Foundation, HIV service providers. It's an amazing, hardworking group of people. I also taught a session at the main branch of the Carnegie Library. It was about healthy relationships, and it was with 10 wonderful youth who are members of their Gay Straight Alliance. This is a weird one. I went to an after-school program in Wilkinsburg, and I taught a nutrition class. That was a control group for a study on teen pregnancy prevention curriculum. And last but not least, I taught a wonderful session with a group of young adults with disabilities who I've worked with for several years. They were a little off the wall that morning, but still we laughed the whole time. We talked about crushes, and people talked about how hard it is to let someone know that you like them. I'm sure no one in this room has ever had to deal with that awkward conversation. So in the middle of all that, I'm checking in with these 5 marvelous educators who it's my job to manage and to make sure all of their very different programs are moving along. I'm doing a lot of paperwork and other random administrative tasks. It's important to know that it's not all face-to-face teaching, and at least in my job, you have to be willing to deal with some tedium to get to the good stuff. I'm working really hard to maintain relationships in the community. I'm cleaning out the basement for some reason. And I'm trying to fit in a lunch break somehow. It's a lot, and I get overwhelmed by it sometimes, as any of my close friends or family will tell you. You might have heard it said, but I have to just say it again. It's true that nonprofit work, and especially work with people, isn't easy. You have to work really hard. It's not for people who want to get rich. But it's work that definitely lets you hold your head high, and you get to collaborate with really passionate, caring, driven people, and you get to be super creative because you have to do a whole lot with not very much. When I'm able to zoom out, like for this talk, I become really, really aware again of how good my luck is, and sometimes I can't believe that I get to spend my time this way repaying my gratitude. So thank you so much for having me. I really appreciate it.